Today, just 2 skin tightening and facelifting remedies. So you have a downturned mouth like this. You've tried all the creams, potions, and lotions, but it's still there. It's just not getting better. Often my patients will say, my mouth is turned down like my face missed the memo that I'm actually in a good mood. You walk into a clinic like mine and you say, I don't want injections. What would I say to you to solve the problem that you're coming in with? Or you say, which is very common, I may be open to injections at this point. Why? Because you're frustrated with it. Let's go through these 2 exact scenarios today, and I'll tell you the exact routine for both of them. Exact. No guessing, because this is so common. You're not alone. It's the number 3 presentation to clinics. Now, you'll be one of 2 types of people most commonly, and we treat them very, very differently, and you need to consider them differently as well. Which one are you? Number 1, you could be a slightly hollow-faced person with sag from volume loss, muscle loss, and bone loss. This is typically a thinner person or a thinner-faced person. Sometimes people carry a little weight on the body, but still have a thin face. Most commonly, they're thin overall. Let's look at this person in diagram, for example. Okay, so here's our first face type. I want you to notice a couple things. Obviously, this is the area that we're talking about here. But I'm going to remove the markings. I want you to look at this notch. You see that notch? That's along the jawline. That says that this fat pad has descended a little bit, and it's also hypertrophied a little bit. So it has grown a little bit. It's not that simple what we're talking about. It's quite a complex process, which is beyond the scope of this conversation. But understand, you get resorption of this fat pad and bone loss, and then that collapses the mouth down. And the collagen loss is indicated by what? The smile line here, the crinkle in the skin. So that's the first face shape. And why this is important is because, look, when there's a preauricular hollow, when there's a notch here, that gives us gain to lift, especially in the second treatment that I'm going to talk to you about today. Now, number 2, you may be a fuller face person with typically good skin thickness and more volume in your face, but a tad of fat pad dysfunction and more fat pad shifting and bone loss at the chin right here. Let's look at this face as an example. Okay, now here is our second face. Obviously, there's more volume here. We don't have that gain here of a hollow to play with. We have a deep fat pad herniation or descent rather here, and a large notch here. And the distance here is short compared to this is long. So anything we add with volume down here, that's going to lengthen this, which is therefore going to make this appear shorter. So she needs the opposite of a lip lift. So this is a compact face. You see how our treatment approaches are going to be very, very different. Now, first, let's go through what won't work. Botox won't work so well because it slows muscle movement down and you have a hollow and loose skin. Not face oils. Now, they will help immediately a little bit plump the area, but overall, it's not going to get to the root of the problem. Number 3, face tape. It won't get it because it's too low down. You could get a pull, but you're not going to pull enough, especially if you have volume in your face. Take your finger here and pull up on the side and see how much force is needed to lift it. That's going to give you a clue as to what you need to do. Not retinol, because you're going to spot treat this area, and yes, you get a little bit of skin tightening, but it's not going to add volume to the area. And a lot of people over retinol, thinking if they put more on, they're going to get more improvement. What happens is they end up getting inflammation, it ages the area prematurely, and it dries out the area. So while you can apply it, it's not going to solve that problem. Piling on the retinol is like yelling at your skin and expecting it to thank you. Not going to happen. Not fillers. Now, people are going to be shocked by this. You can put a little dab of a filler there, but remember, you need a little pull this way, right? Because if you just fill here, what did we do? We squared your lower face. What is square? Males are square. Female have an inverted triangle, which can become the pyramid of age. And by adding fillers here, we've made someone more a pyramid shape. But you can put a tad of fillers after you get some pull and tightening like I'm going to show you about today. Now, before we go on, is a facelift in the cards if you have a downturned mouth? Yes. Especially if you have a situation like this one. Certainly a facelift's in the card. But remember, that's going to remove loose skin. Yes, you can add fat transfer with it, but you can't just go suck all the fat out if you're a fuller face. Why? Because there are nerves there, and you don't want to damage the nerves because you'll look funky, you won't move right, and when everything settles down, you can end up with irregularities. So yes, a facelift can be a great treatment to remove the loose skin, but often even if people get a facelift, they do these other treatments to fine tune it. So there's 4 main reasons why people don't want the facelift. Number 1, you get a lot of scarring. Of course, it's the most scarring of any procedure we do, obviously, and when you approximate the tissues, you get scarring underneath. Obviously, the downtime, no matter what, yeah, you're going to look good potentially in 2 to 4 weeks, but you're not going to be back to seeing people if you don't want them to know. Think about 2 months to 6 months is how long it takes for everything to settle down and you to look sculpted again. Number 3 is money, of course. Depending where you are, it's about $35,000 now to $50,000. Hollywood facelift, $75,000 to $250,000. $250,000 down there. That's not uncommon. And number 4, of course, there's still a stigma, even amongst people who you think wouldn't mind people knowing they're getting it done. Like, I don't want anyone to know I had surgery. Even when people get face tape, they put face tape on. They're like, oh, I don't want people to think I might have had surgery. Who cares anymore? But that stigma exists. So our first treatment for either face at home is going to be a device, obviously, because you've tried all your creams. Now, you could try a galvanic device or a microcurrent, but there's 2 that are going to get you the potential results. One is RF or radio frequency, and the second is an ultrasound device. Now, if you're in the USA, a radio frequency device is what you're going to find. The number 1 device you want to look for is called the NUA. That's the one I give to my patients. It's radio frequency. It's safe. It's effective, and let's look at a treatment now so you get an idea all about it. At the end of the treatment demo, I'm going to give you a special on it, but let's go to the treatment so you can see what it's all about and exactly how to use it. So you can see here she's using circular motions. Now I said safe, right? And the reason is there's built-in mechanism that will stop the device if it gets too hot in your face. Why is that important? Because if you get the temperature above 43 degrees Celsius, and this monitors that, then you might lose facial fat. And you might say, well, that's okay at the outside, the lateral area, but it's terrible if it's medial to that. We're going to address that in a minute. Now, before we go on, for those of you interested in the NUA device, for viewers of this channel today, I put a special on my website. I'll pin it to the comments below. A free $285 gift. And to the more info section below this video, you get a free lipo-filling cream, which you can use in front of the melolabial fold that I demonstrated, and you can use it in the notch in the preauricular area, as I'm going to show you in the upcoming video. But you get this free with your purchase for viewers of the channel today. Also, you'll see there's a green light on the device. It turns green when it gets to the hot temperature, and it's blue just before. It works with blue or with green, so you don't perseverate on that. But it does give you an indication of when you're at the hotter levels. But again, it does shut down. Now, how often do you have to do it? Because that can be a deal breaker for many people. Now, you can see there's no downtime here. The treated area is a little more red, and you can see a little lifting effect in that area. Here's a longer term result in an older patient if you prefer that. But this is a longer term device that I want you to use as part of your skincare routine. 3 to 4 times a week is enough. Now, it's not just for the downturned mouth. You can use it for the brow lift as well. You can see here, she's using it in the forehead to get a brow lift. The brows lower as we age. And you can see in this before and after, you even get an immediate result with it. Again, we want the long-term effects, so something you use a few times a week. And there's not a lot of fat in the forehead. So again, you don't want a device that's going to get rid of your facial fat unless you go into a clinic, and then you can use things like RF microneedling to target the fat area specifically. But that's going to be your best device for something that's FDA cleared. When you think about all your facial devices, think about cost per use. A skin cream, let's say it costs you $50. You're going to buy it every 2 to 4 months. If you think of a device, it's going to last you many, many years, and you're going to use it 3 to 4 times a week. So devices, in fact, are very cost effective, and you don't need to go into your clinic to get all your devices anymore. Ones like the NUA are actually made based on in-clinic devices that they also sell. So you know you're getting that technology with it. Now let's go on to treatment number 2. Remember I said you may be open to getting injections. Okay, great. I'm going to take you through the exact series of injections in the locations that I just had a week ago because it represents what many of you are going to want too. And I used a combination of Sculptra and platelet-rich fibrin. Let's go through the exact areas you want to get a lifting effect at the jowl. If I'm demonstrating on this original face, the injection points, look at that. We have this to gain. We can inject up here. We can give her a higher cheek because you get resorption of the zygomatic arch in the bone, so we can bring the cheek up. Sure, you could inject here. It's not what we're talking about today, but imagine that you can inject some biostimulator through here, not in the lip area. That would be more hyaluronic acid filler, but you come by right here and you give her that chin projection because the chin would have had bone resorption as well. And that's all biostimulators. Yes, you have the facial artery coming up here into the nasolabial, into the angular artery there. I guess I can draw that in red just so you see that. Because your injector, switch here to red, the injector needs to know, right? Here's your masseter, okay? But your vessel comes up here and forms your angular artery here. So you got to be very careful by injecting this notch here. So gives you an idea of the complexity, but remember, concentrated versus dilute doses of Sculptra and PRF are very, very important. If you want all natural, go to PRF. You can combine PRF and Sculptra. In areas where you really want the most power and stimulation, you can just use plain Sculptra and add PRF where you don't want to add that much volume, but you want to change the skin density, thickness, and you want to help the fat pads. PRF is going to help your facial fat pads. Now let me use this diagram here to show you a treatment option when you want to choose injectables. PRF and Sculptra is a great option, but here's exactly why and how. Remember this hollow that we talked about right in through here, and the patient had the notch right here? Okay, so what we want to think about here for injection points is along the jawline here, along in front of the ear here. Those are often hollows, especially in thin people. And we can reduce this hollow a little bit, especially if we're willing to put a little bit of product in the high cheek. And the high cheek is youth, beauty, and fertility. Everyone likes a little higher cheek. Of course, some people overdo them. So that's part of the combination there. I guess I'll leave those markings on and show you the rest. So then this is going to pull back. When you treat these areas with something like Sculptra and PRF combination, and Sculptra is now FDA approved for tightening the jawline by injecting up here. But I'll remove those markings so you know exactly how this is done. Inject here, here, high cheek, that's going to give a little lift here, but then you're going to inject a little in the submalar region here. But here's the key. You come down and inject in the anterior chin area, and then you can actually feather some product through here. Because you remember the prior picture at the very beginning of the video where the person had the hollow and the crinkly skin, the crepey skin, the cobblestoning in front of the mesolabial fold here? We need to tighten that up, and we have the room to add volume. The fuller face, and why that was important to talk about in the beginning, the fuller face, we could not add the amount of volume we do. Because imagine if you took that face and you added more volume, it's not good. But there's something we can do. You see, in this face, we want a concentrated dose. And this is where your expert injector comes in. We want a concentrated dose of product. In the fuller face, what do we want? We want a dilute dose of product. That's because we want skin tightening without the volume. But we do want concentration in the chin area where we can add volume. So the thinner face, the hollow face, is easier to treat. Now, a common question you get asked now is, does Sculptra cause scar tissue? Well, PRF does not. Of course, it's all natural. Sculptra, watch this video right here. You may be shocked to find out the answer. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.